ways to manage all that for them. Don't see anyone online yet. Yeah, the biggest feedback that we've gotten from everybody. Thank you. The biggest feedback that we've gotten is just having access to like knowledge and stuff that they didn't have before, that they don't really get on a regular basis about their arthritis. So that's been really beneficial for them.
Yeah, these stuff there. Cool.
Yeah, yeah, absolutely. Yeah, we actually did one of our we do a week on like health literacy. And one of the things we talk about is like how to decipher a knowledgeable and good source of information versus bad. So yeah, we do. Yeah, WebMD, Wikipedia, all those things. So, but yeah. Yeah, please stop. Yeah. I would have saved you 2 hours of random computer knowledge. Yeah, yeah. That's funny. It's funny because my mom's the absolute opposite. She'll like let something go for like 2 weeks and then be like, oh, I guess I should get this checked out. I'm like, please, just again, text me. Hey, should I be concerned maybe? Yeah.
We'll see how you are.
Right. Sleep on it. Yeah, that's pretty apparent when it's broken. Yeah. Yeah. Go ahead. Just kind of set this up if you're good with it. Are you good with me turning the camera on so we can get the slides? Okay. All right. Well, here we are, maybe. Oh. Uh-oh. Yeah. Something. We have to get that box fixed if it cut off that easily.
Thanks.
Yeah. Should wait a second. Oh. There we go. Yeah, you're good.
All right, well, thank you everyone for joining today. My name is Dr. Schwartz, and today we're talking about chiropractic and arthritis. So a little bit about me first. I'm a chiropractor here at the Cleveland Clinic. I've been here for about 2.5 years, and I was in private practice for a long time prior. But I also do wear a couple different hats here. So I do a lot of ergonomics here at the clinic, sports or professional gaming medicine, which is really fun. A couple colleges and pro teams. Workplace wellness, employee health, and then lastly, I ran a blog for about 5 years focused on wellness, mainly ergonomics, desk ergonomics, driving ergonomics, exercise for deskers, kind of everything surrounding desk wellness. So today, I kind of want to give a brief overview of how we approach chiropractic here at the clinic, that it might be a little different than some of the other chiropractors you've seen kind of out in the wild. Going over kind of how that visit would go, and then taking a look at what we want to have you guys do as homework. Okay, so first we got to figure out or understand why we're here, how we got to this point. I think that taking the detailed history is crucial when it comes to looking at the whole picture of a person and looking at holistically rather than I have knee pain. You need to know how we got here, what's going on. We'll touch on a little bit later, but the EHR component is really helpful here at the clinic. We need to figure out how we got here past surgeries and kind of looking at the chart prior. And then we need to know what makes it better or worse. With some arthritis, moving makes it feel better. With some, it feels like, if I take a break, it really helps out. So we need to figure out what works best. Movement, heating, icy, different exercises, anything that kind of can give us a kind of hone in on what we want to look at for arthritis. And then what you're doing throughout the day, daily activities is crucial. Are you moving a lot? Are you doing a lot of sedentary work? Are you working at a desk? Are you doing stand up? Are you up and down, driving a lot? Those all play a factor within causing that arthritis or causing that pain that you're associated with that. So we need to know what you're doing throughout the day, and that will help us. That will help us kind of get a better detailed history of what's going on. And then finally looking above below it. So for example, when I have knee pain, okay, we get that you have knee pain, but we need to figure out above and below what's going on biomechanics. So have you had past ankle injuries? Have you had hip pain before? Total hip replacement? We need to figure out what's going on above and below because those contribute to that joint, not necessarily just at that spot. So that's why I really like looking above and below, looking at whole picture, and looking at this detailed history before we kind of get into any of the examination. And usually this is reviewed prior. So when I come in, I have like a little notepad that I use, and I just kind of scribble down some notes for myself so we can kind of get rolling on the exam right away. And I have pretty much all this detailed before we kind of come into the new patient appointment. So as I touched on earlier, being at the clinic helps out tremendously compared to private practice when it comes to looking at EHR and medical records. When I was in private practice, I would send out a request form for an individual, and it would take me a week to get it. It would be on faxed over on terrible black and white. You could barely read anything. It was really difficult for me to get a whole picture of what was going on and prior. So now being at the clinic, it's amazing because I can look at, starting out the treatment team. Where have you been already? Have you been to neuro? Have you been to ortho? What have your primary care been doing? Really taking a look at what they've been doing helps me get a picture of what's working and maybe what isn't working and how we can approach them. Biggest thing, and I really love at the clinic, is the image review. So any previous x-rays, any MRIs, any CTs, I can look at all that. I can look at the image. I can also get the report from the radiologist as well. So that gives me a really great picture. Because if you have recently got an MRI of your neck, there's no reason I need to order an x-ray for these cervical spine. Just makes no sense. So it really helps me out tremendously. Like, we got to know exactly what's going on. I can look at it myself. I can look at what radiologists interpreted as well. That gives me a great snapshot moving into the appointment. And the other component is the whole picture. So we can look at labs. I don't do a ton of that, but we can look at lab, look at what is, if you're in PT, what is PT doing that we can focus on that I might have a different approach to add on to that. But it's really great to have that, because that kind of brings us down to this multi-pronged approach where each specialty has their own kind of niche and their own strengths. But it's really helpful because I do biomechanics and I do musculoskeletal conditions, but I also do a lot of exercise, soft tissue work, and traditional chiropractic work. Whereas if you go to PT, it's going to be nice because they can really go one-on-one with you with exercise, take a look at ortho, they can do some injections. So it really helps do that multi-pronged approach. With most arthritis, it is a little more complicated case than someone who's coming in with an acute knee injury. So it's really great to have that whole team approach, and really everyone just really communicates really well within the clinic. I've had some really great experiences with you being on multidisciplinary teams for patient care. So the treatment, how are we gonna solve this puzzle that we call arthritis? So with the treatment, initially we come in, we have the detailed history already. Now we want to take a look at orthopedic testing. So we take a look at dermatomes and myotomes, basically, you know, skin, how you feel in the skin. Is there muscle strength within that? Take a look at reflexes, which everyone knows the tried and tested one where everyone hits the knee and the knee flicks out. So those are some of the ways that we try and get to the neurological component. Then we go into the orthopedic. That's more tests that kind of give us an idea of what's going on in here. Is it X? Is it Y? Okay, this test says this test says this. That gives me kind of decision tree to go down. And then we also, as being a chiropractor, we do a lot of hands-on obviously. So soft tissue importance is critical. You know, yes, we have irritation and annoyance at that joint, but the soft tissue is almost always playing a component within that. Whether it's, you know, a muscle imbalance, whether it's an old injury or adhesions within the fascia or the muscle, all that plays a critical role in supporting that joint, because that joint needs support from the musculature in order to move, in order to be stable. So if it's not, we need to figure out why is that occurring. And once again, looking above and below, looking at past injuries, but the soft tissue importance is sometimes overlooked. And that's from when I practice here at the clinic, that is one of my big things. Before I even almost look at joint, usually it's looking at soft tissue, looking at muscle imbalances, looking at biomechanics. And then of course the chiropractic mobilizations, manipulations. Everyone's seen YouTube, TV shows, TikTok and all that, and intense things. To be honest, you know, most of us here at the clinic are doing a very dialed down version of that, because do the soft tissue work first. It's put a lot less force when it comes into that. So while it gets views, the stuff that we do is probably not going to get any views, but it's effective. So I think everyone would rather have that. So, and then another component I really love, some chiropractors do it a little bit. I do it significantly with my patients, is kinesio taping or rock taping. And I really like that for two different reasons. One, I like it short term because we do a lot of muscle work, we get a lot of stuff moving, and then we want to kind of stabilize that or shore that up with compression. So body loves being compressed, feels more stable, it can generate more force, a lot of different things. So the taping short term, I love, patients love it because they feel more stable, they can go do whatever they want to do for the next couple of days or the week. And it usually lasts about 3-4 days. But the long-term thing that I really enjoy, and that I think the patients eventually realize, is when you have stability and compression within an area, the body loves it. It can move, it can do whatever. So it's important for us to have that stability in our day-to-day lives. So the exercises that I give, I'll touch on that later, but the exercises I like to give are almost always strength-based. So with that strength, it's really targeted in that area. So for instance, if you have chronic SI pain or low back pain, we want to take a look at, you know, we want stability in the glutes. We want to take a look at hamstring tightness. We want to take a look at low back tightness. And typically, it's not going to be, oh, I have tight hamstrings my whole life. Why is that? It's typically because this glute is unstable and the body's trying to recruit these guys to help it. So that taping, we tape in the low back and tape that SI joint. What happens is, get up, move around, it feels great. And that tells the patient, like, hey, if I do these exercises and not actually just ignore them the whole time, if I actually do these things, I'm going to have stability. I'm able to do what I like to do. That really helps me kind of hammer home the fact that these exercises are just for fun. These are really beneficial. These are actually long-term effects. And the last thing is self-mobilization. So with this, I like to use, some people use a massage gun, and very careful with that. A lot of people will, I've had patients with bruises and burns because of the massage gun, because they just hold it in one spot. We don't move it around, and we just kind of push it as hard as we can. It feels good while we do it. 10 minutes later, it feels worse. So if you are using a massage gun, typically we want to go on medial portions. So here, pec, glutes, hamstrings, low back, anything that's got a little bit more musculature to it. I do it on sensitive areas like anterior neck. I've had patients do that, please don't do that. I've had people do it on median nerves, ulnar nerves. I've seen a lot of that as well. So really making sure you're on more medial structures, then barely resting that thing on your arm or on your appendage, and then constantly moving it. So don't just try and hold it onto one spot. We want it barely resting on there, keeping it moving. Another tool that I like even more, and is a little more forgiving for people just starting out with this, is a lacrosse ball. So lacrosse ball is great because it's portable. You don't need to charge it, and it costs like $3. So it's wonderful. So you can use it, and I usually bring one. I don't have one with me today, but you can do it for pec. So you can put it against the wall. So you can put it between your pec and the wall of it. So you can put it on the glute, put it on low back, and you can go up and down here. You can be on the floor, and you can work hamstrings and glutes. Glutes, just be very careful of. I want to say lower glute, hamstring, and calf. I'm okay with on the floor. Back, upper glute, things along those lines. You can't really control that depth, that pressure. So be really careful of that, because I see patients do that too. So on those cases, I'm more of a fan of foam rolling. It's a larger surface area, a little more forgiving as well. But that is really nice because one, you can keep it, if you're sitting the same spot at home all the time, you can keep it there. If you're at your office, you can keep it there and keep everything. Because the more we can keep that tissue pliable, the better those joints are going to move. It's going to improve blood flow, so it helps with the healing process as well. So it's just a really great thing. Like I said, it's $3, so it works out really well. And then moving. So with moving, I assume a lot of the people that have presented here have talked about this too. Moving is just crucial. Like your body loves to move, both physically and mentally. And my prescription with people is always, look, move how you like to move. I love doing hits, weight training. I hate running more than anything in the world. So I will not run, but I like doing those other things. So if someone told me, I need you running 2 miles a day, not doing it. I'm just going to, hang out on the couch. But if you like to run, that's awesome. So if you like to run, let's run. Let's start with, maybe I'm running 5 minutes. See how you feel that day, next day. Feeling good? All right, let's go to 10. And slowly ramping up to that. But moving how you want to move is going to make you more apt to do that. So if you love gardening, that's great. Let's get you gardening for a set amount of time, really working towards that. The other thing I like is dynamic. So when I'm in dynamic movement, if you are sitting throughout the day, I want you kind of moving or fidgeting or changing chairs. Ideally, sitting on a little more firm chair where I'm glad it makes you feel uncomfortable if you're sitting more than half an hour, because that makes you get up. If you're sitting on a recliner or a sofa and just slowly becoming one with the sofa, that's not a good thing, obviously. So moving throughout the day, whether it's seated or whether you're putting your leg behind you or you're kind of sitting this way or sitting this way, moving more throughout the day just helps everything function better. And kind of what we touched on before, any movement is good. So I don't, if you love to do aquatic therapy, that's great. If you feel like, just going out for a simple walk for 10 minutes, that's a start. But everyone has to start somewhere, right? So even if you're like, oh, I can only go for 10 minutes, that's fine. We figure out, okay, 10 minutes, maybe I go for 30 minutes, I have pain, but maybe I can go for 10 minutes 2 or 3 times a day and I don't have pain. So we're still getting that input, but we're not getting those detrimental effects of causing pain, causing that irritation. And the other thing is the mental component of it too, where, you feel down when you're sore from doing a half-hour walk that you love doing. So let's do 2 or 3 of those for 10 minutes. You're going to feel better. You're going to get green space. You get nature. We're going to have eye resets because of not staring at a screen the whole time. So don't get discouraged if you only do X amount of time at the beginning. as we slowly work up into that. But the fact that you're doing is, 99% of the issues. So that's really great. And like I said, anytime you can move. And exercise. So I kind of touched on this before, but when I prescribe exercise, very rarely is it just straight up stretching. It's usually a soft tissue component of the cross ball, maybe massage gun, but really focused on getting that soft tissue moving. If it is going to be stretching, it's typically going to be a dynamic stretch. So for instance, if I'm doing upper body, I'll do a dynamic stretch where I'm alternating through here, or maybe we'll do like a hip swing coming through here, or we'll do it in the lateral plane, or maybe we'll do like a walking lunge or anything along those lines to get that full component of movement rather than just a straight up static stretch. Because a straight up static stretch, I mean, you have to hold that thing for over a minute to get really any results. And a lot of times it's not going to be that beneficial because you're also tensioning nerves, which hate tension, hate stretching. So dynamic movement gets the muscle moving. It promotes blood flow within that area. It promotes joint mobility, which is also great, which for arthritis we especially want. And it really helps your body be comfortable within a movement. So if I have like a acute low back pain or called like a hot back, what we want to do is get the body comfortable in that position, telling the body, hey, you don't have to spasm. We're okay with moving in this position. So for instance, if I have a hot back, I'll tell patients very lightly some hip swings. And maybe you're only going, a foot or two in either direction. Then later on that day, maybe you can get 2 feet. And we're slowly getting the body comfortable again with moving in that plane or moving in that direction. And that's what we want. So that's my approach to kind of the stretching dynamic. But we also want to address muscle imbalance. So I really, really, really emphasize strength training. So, and it doesn't have to be, I'm not asking anyone to go out and join CrossFit and, do 100 burpees in an hour or like in 10 minutes. That's not our goal. Our goal is to try to address those muscle balances. So if we sit all day at a desk, what do we want to do? We want to work glutes. So maybe we'll do Pilates-based work. We'll do some clamshells, some leg lifts. We'll have resistance bands, loops that go around the upper part of the knee. That's what we like to start off with there. And then we'll do some soft tissue mobility on that hamstring, on that low back. Because as that body and as that glute becomes stronger within that lumbosacral region or kind of here, that will release that tension that is constantly put on upper or low back and hamstring. Because the body, from the body's perspective, it says, we want to move in this plane. So you're going to find a way to kind of walk and do something you love doing. It's going to cause pain. So the body says, all right, we're going to do this, but we're going to have to spasm above and below that joint in order for that joint to be able to function properly. So that's why I have a lot of patients come and say, oh, I've always had a tight back. I always have tight hamstrings. That's typically because we have weakness with that glute because they've had a desk job. So us strengthening glute actually relaxes back and hamstring much more than just stretching, and hoping it actually gets better. So that's why I really love to address those muscle imbalances because we see such a fast turnaround. And then the timing of the exercise. So I like, morning, maybe mid-afternoon is okay. I personally love working out in the morning before I go to work, but I know everyone doesn't like working out, getting up in the morning. It's just kind of person dependent. I get that. But we definitely don't want to be doing those exercises later on in the day, especially, hour or two before you go to bed, because that can create some of that micro trauma or that work that we do within that area is great. That's what we want. That's how we build muscle. That's how we improve vascularity, everything. But we don't want that before we go to bed because then all of a sudden that'll sit in there all night, cause some irritation, and then you wake up in the morning, feel really stiff. And, they'll come in and say, those exercises are terrible. You don't know what you're talking about. But if we can do them early on in the day, we'll notice a big difference with that. So always trying to do them later on in the day, at the latest, maybe 2 to 3 hours prior, but never, an hour before. But the other thing is, I don't expect you to do 20 exercises for 30 minutes every day. That's unreasonable. But I think what we can all do is 5 or 10 minutes a day. 5 or 10 minutes while we're watching Netflix, watching TV, hanging out on our phone. But we can do 5 or 10 minutes a day because that increased frequency is going to be much better than you just doing it once or twice a week will happen. I'd rather you constantly getting that input within that tissue because that helps you get better quickly. And then heating and icing. This is kind of, condition dependent and person dependent. Typically, I would say heating morning, mid-afternoon, or if it feels tight and stiff or a chronic condition, I like heating a little bit. Icing, I like if it's after activity, before you go to bed. That's when I typically like icing, or an acute injury, like I just sprained my ankle, obviously. But typically for like OA or something that we see, I like heat a little bit more, unless it's after activity, then I like icing a little bit more. But once again, it's person dependent. Some people do well with the contrast therapy. Some people hate ice. Most people hate ice, especially now until like March. I tell a patient to ice, and, all the joy from their face drains. So I know that icing isn't ideal, but it really helps. So if you really don't like icing, I'd recommend either getting a heating pad. You can put it on your lap, chest, something like that. Go under some covers, something along those lines. But really trying to ice after activity or with an acute injury or before you go to bed, that'll help you sleep. That'll also help with the pain that you might feel in the morning with all that stiffness, achiness that occurred with those micro traumas throughout the day. And now that's sitting in there all night, causing that irritation in the morning, sore, it's achy, and then all of a sudden you get in the hot shower, you put some heat on it, actually it feels good because that blood's coming into that area, kind of cleaning it out. So heating icing is kind of a personal preference, but there's kind of a couple of rules of that I use. And this is our contact information. So I'm part of the Integrative and Lifestyle Medicine team here. So we have chiropractic, acupuncture, holistic psychotherapy, psycho health. We have nutrition, and then some functional med doctors as well, and integrative medicine doctors as well. And we have locations everywhere. So for chiropractic, I'm in Twinsburg. There's another physician that's in Twinsburg as well. Basically everywhere on the east side. I'm at main campus as well. And then we have Medina, Strongsville, Lakewood, and Amherst on the south side. So we're kind of all over. But what's really great is we're literally everywhere, which is nice. So that's our contact information for appointments. And then this is my blog for the wellness. This is ergonomics, nutrition, hydration, basic nutrition, hydration, a lot of targeted exercise, and overall wellness strategies for working at a desk or more sedentary stuff, and a lot with esports and gaming as well. So thank you very much for having me. Thank you.